Hello, I am Dr. Miles, and today I have a profoundly important message for you. It is a message that could quite literally save your life, or the life of someone you deeply care about. I am urging you, begging you, to pay close attention to the subtle facial signs of a stroke. Many strokes, the kind that can steal your independence and change your future forever, begin with just a tiny, often overlooked, change right on the face. A slight droop on one side of the mouth, eyes that do not quite align, or simply an expression that looks subtly off. These quiet warnings can appear and then vanish in mere minutes, but if you recognize them, they offer a golden opportunity to stop a stroke before it causes permanent damage. Today, I will reveal the 4 critical facial signs of a stroke, insights compiled from extensive medical research across leading institutions in the United States, Germany, and Japan. Do not wait for a full-blown emergency. The question is, will you be sharp enough to notice these crucial signs when every second truly counts? It is a sobering fact that millions of people over the age of 60 inadvertently overlook these subtle, yet life-saving signs every single day. They might dismiss them as tiredness, a stiff neck, or simply an effect of aging. But these small changes are your brain's earliest cry for help. Understanding these signals is not about creating fear, it is about empowering you with knowledge, giving you the ability to act swiftly and decisively. When we talk about stroke, time is not just money, it is brain. Every minute that passes without intervention can mean the loss of millions of precious brain cells. By the end of this video, you will not only know what to look for, but you will also understand why these facial signs are often the very first indicators and why your ability to spot them can make all the difference. Let us begin with the first vital sign: an uneven smile. In a healthy state, when you smile, both sides of your mouth lift up together, creating a balanced and symmetrical expression. However, during a stroke, one side of the mouth frequently loses its ability to lift in sync with the other. This results in a smile that is noticeably uneven, often appearing crooked. The reason for this lies in our brain's sophisticated control system. Each side of your brain controls the muscles on the opposite side of your face. When one side of your brain suffers from a sudden lack of blood flow, the muscles on the corresponding side of your face stop receiving those vital signals. Consequently, that side of the mouth simply cannot lift. The cheek becomes weak. And, remarkably, the person experiencing this often feels absolutely no pain or discomfort at all. They might still be able to talk, still respond, and even insist, "I'm fine." Yet their face tells a different story. Have you ever observed someone smiling and felt that their face looked subtly uneven? It might not be shyness or awkwardness. It might, in fact, be their brain urgently calling for help. The second crucial sign to watch for is a drooping eyelid or cheek. You might notice that one eyelid appears lower than the other, not opening evenly, or that one cheek seems saggy, as if it has suddenly lost its muscle control. This visual asymmetry is a very clear and alarming warning that the facial muscles have lost strength, indicating that the brain may not be receiving an adequate blood supply. Damage in the area of the brain responsible for controlling the face muscles directly interrupts the signals from reaching those specific muscles. At that critical point, the muscles around the cheek and eye on the affected side no longer function normally. That side of the face may look softer, less alive, or even just tired. It is easy and tragically common to mistake this for mere fatigue or a lack of sleep, believing it will simply pass. However, when the face has already begun to droop, it means the brain has already ceased sending proper signals to that particular region. I urge you, if you ever look at the face of someone you love, or even your own reflection, and feel that something looks subtly off, do not ignore that feeling. That intuitive sense, that quiet alarm bell could be the one thing that saves their future, their ability to live fully and independently. The third sign involves the inability to move one side of the mouth when pressing lips or speaking. To check for this, you can ask the person to press their lips together firmly or to blow gently, as if they are whistling. If one side of their mouth cannot stay closed, or if air leaks more to one side, it is a significant indicator that one half of the fine control muscles around the mouth has been affected. During a stroke, when the part of the brain that governs the mouth muscles does not receive enough blood, the person loses the delicate ability to coordinate their lips, cheeks, and tongue. They may still be able to speak, but their voice often sounds slurred, and their words are not clear. This can unfortunately be mistaken for sleepiness or even being under the influence of alcohol. Even when attempting to articulate simple sounds like pa or ba, one side of the mouth might hardly move at all. If you are watching this video with a loved one, I encourage you to ask them to press their lips together right now. Observe carefully. Are both sides even, or is there a subtle imbalance? The fourth subtle yet highly reliable sign is the inability to raise both eyebrows or frown evenly. This sign can be very subtle, which is why it is often overlooked, but its reliability is immense. If you ask the person to raise their eyebrows as if in surprise, or to frown deeply, and only one side of the forehead moves while the other side remains flat and unresponsive, it signals a problem with how the brain is transmitting signals to the face. This is distinct from other facial issues, such as those caused by nerve pressure like Bell's palsy. In a stroke, typically only the forehead, cheek, or mouth on one side will stop responding, while the other side continues to function normally. This crucial distinction helps you differentiate between a localized nerve issue and a more serious problem within the brain where blood flow has been suddenly interrupted. The forehead, though often overlooked, can be a quiet area that speaks up first when something is wrong with the brain's signals. Looking at the forehead is akin to checking a crucial warning light for the brain. If one side is flat, lacking movement, you do not need to wait for additional signs. It is time to act immediately. All four of these signs, as subtle as they may be, can appear for just a few minutes. But if you miss them, you may lose the golden chance to prevent permanent and devastating brain damage. According to compelling statistics, approximately 80% of strokes exhibit clear signs on the face within the first 10 minutes. Yet, sadly, many individuals are unaware of these signs, or they are not confident enough to dial 911. By the time the symptoms progress to affect the arm, leg, or ability to speak, millions of vital brain cells have already been irrevocably lost. Do not wait until the person can no longer speak, or until they stumble and cannot stand up. Just one uneven smile, one subtly drooping cheek, or one unbalanced facial expression can be enough to save a life, to preserve a future. But what matters most, what is truly powerful, is to understand why the face changes first. Because once you understand the underlying mechanism, what is truly happening within the brain, you will never overlook those signs again. In the next part, I will explain precisely what is going on inside the brain and why just one small blood clot can alter the entire face within minutes.